First, while most of the country is passing restrictive bills on abortion, California is going in the opposite direction.
A new state law means more healthcare professionals can now legally perform abortions in California. Governor Jerry Brown signed that legislation that now lets nurse practitioners, physician assistants, and midwives legally perform abortions in the first trimester. Oregon, Montana, Vermont, and New Hampshire have already allowed nurse practitioners to do so. Assemblywoman Toni Atkins of San Diego wrote the legislation and says the law will help expand access to abortion services in areas of the state where there are few physicians. Republican lawmakers in opposition argue it would increase risks to patients. 23 ABC's Chris Ornelas dug into the new law to tell us what it means for Californians.
The law signed by Governor Jerry Brown earlier this week says that nurse practitioners, midwives, and physician's assistants can now perform abortions.
I think it's great that Governor Brown signed this bill into law. Anything that expands access to abortion providers so that women can make the choice whether to keep their child or not is good news.
The law says only the most common type of first trimester abortion can be done by these non-physicians, and they must have specialized training before performing the procedures. Pro-life groups here in Bakersfield don't like the new law.
We're against abortion for the sake of abortion, because there are people who go get pregnant, maybe have the baby just to have food stamps.
People we spoke to who are against the new state law say it will make abortion too easy, and some women may begin using it as a form of birth control.
There are also people who just go, but mess around, not take responsibility for their actions, and this is where they come. They come to just run away from the consequences of their actions.
Obviously, women should not have abortions as a form of birth control. Nobody wants to see that.
Those in favor of the new law say it will help women in rural areas where a doctor may not be available.
Women in rural communities, they need to have that access. They need to have the equal access that someone in an urban community has.
100% of people who are in favor of abortion have never experienced an abortion. All those people are alive talking today.
In Bakersfield, Chris Ornelas, 23 ABC.
The new law takes effect January 1st, and 47 non-physicians have already been trained to conduct the procedure.